Perfect. Thanks, Sabine. So yeah, thank you for having me. And nice to see and hopefully meet some of you this afternoon through a bit of Q&A later on. So as Sabine said, my name's Tim Brazier. I'm a designer, and if my slides will let me skip through. There we go. So yeah, this is me. I'm Tim. I'm a designer and I'm the managing director of a team called Thrive by Design. And just a little bit about me, just to give you some kind of context. So I've been co-designing and working in and around co-design of digital systems and platforms, as well as the kind of pathways across health and community sectors that kind of fit around digital rather than directly the digital systems themselves. So that's kind of been my career for the last 10 or so years. And previous roles have been very much on the creating digital side of things at some digital agencies, really focused on developing digital services for non-profit organizations. And then I had a 3.5 year stint at an amazing charity called Good Things Foundation, who are focused on improving the social and digital inclusion of people across the country. So lots of different varying kind of ways in which I've applied design thinking and service design to try and help solve some problems and make things better for people. And what I'm really quite passionate about personally and try to kind of instill through our team and the work that we do is design and design thinking, which I'm going to talk a little bit more about in a bit more detail this afternoon. I've kind of experienced it being quite an exclusive thing from being like on the inside of that industry, if you like. But I'm a really big believer that it should be and really can be accessible and used by anybody within their roles and within their work to make things better for people. So today I'm going to kind of talk through a few examples of how we apply that and hopefully make it seem like something that you can quite easily bring into your work and apply it to the things that you're doing. So that's a bit about me. And then just again for a little bit of context, Thrive by Design, I'm not going to say we're completely unique, but we're kind of towards that end of the scale in that we are a design and research team that are actually based within the NHS. So we are, as a team, we're employed by an NHS trust over in Leeds. But we are commissioned to do all of our work by all sorts of other organisations and different parts of the NHS. So yeah, it's almost like a bit of a business within the NHS that works with different teams across the country. And we take a co-design approach to all of our work because we really do believe that bringing people with lived experience in to help solve the problems that they experience and they face is the real key to kind of unlocking it and making sure that the solutions and the improvements that are made are kind of fit for purpose. Really. Okay, so that's just to set us up a little bit about me and the team at Thrive. So what I'll be talking about is design thinking. So some of you, all of you may already be really aware of what design thinking is or have heard of it or be using it or you might even be a better expert than me in it, which is absolutely fine. But this is for me to kind of just share my experience and understanding and see how we're applying it in our work. So I'll be talking about that. I'll show a couple of examples of how we've been supporting teams across the NHS to take this approach themselves. There's a couple of different examples in there. And I'll finish off by just sharing some of the kind of design principles that we use to guide our work. And there's a few useful links and resources as well at the end, which we can share. Okay. So design thinking and how we use it. So I can't see everybody, so I can't really do a kind of show of hands or nods or anything like that. But this is what I first discovered as design thinking. So this is IDEO. I'm sure most people have heard of IDEO, or if you haven't, there's loads of resources and information from them across the internet. But they kind of really popularized this design thinking model about 20 or so years ago now. So it's this 5-step kind of approach to innovation and problem solving. So they start by empathizing, defining, ideating, prototyping, and testing. So that's kind of one model that you may have seen or may already kind of use. And then another one that's kind of really inspired us is the Design Council's Double Diamond. Again, it might be something you've seen. There's things like the kind of government digital service took this as a lot of inspiration with their development kind of approaches and methodologies through alpha and beta phases. So you'll see kind of incarnations of this across different areas of work as well. But again, this is something that we've kind of taken a lot of inspiration from, and I have personally over the last kind of 10 or so years to understand how we can apply this thinking into projects and products and services and improvements that we're trying to make. If you're really interested in the double diamonds, there's a new kind of, they've been iterating it over the last couple of years, but there's a new one which is really about systems thinking, which is really interesting. They've kind of really built on this and built it out into something that I think can be quite useful as well. So, like I say, these two things especially have really influenced us in the way that we approach our work and approach the projects and the problems that we are asked to come and help people with. But one of the things that we're really clear about is that rather than, as you will see on the previous slides, these are almost kind of left to right, fairly linear kind of approaches. Is we see it as much more of an iterative approach, something that you can kind of go round a number of times in whether that be in really short periods of time or something you can kind of extend over a longer period of time. But I'll try to explain what I mean in a little bit more detail here, and hopefully it makes sense. So the 5 stages, and we've changed the words a little bit here. So instead of empathize, we've talked about understanding. So working with people with lived experience to really understand what's going on for them, see what they are experiencing, and really trying to understand what matters to them. So really digging into what the problem is that you're starting with. Then once you've done that, you often find that there's loads of things, loads of problems, loads of kind of ways in which you think you can make a difference. So the next step of that is to really prioritize and define what it is that we should be starting with. So taking a really pragmatic approach to that of going, what can we do now? What can we do first? What's the kind of most important thing that we can do, or the highest value thing that we can do within this process? And once we know where we want to start and we've prioritized that, we get into kind of co-design. So that's I think they call it ideate in the IDEO model. But that's where you bring people together and really start to go, okay, so how we've understood the problem, we've defined or identified where we want to start this. What could we do about it? So really opening up what those ideas are. And there's tons of different techniques of doing that in terms of bringing people together, doing workshops, or kind of being out within context and doing all sorts of different things to creatively come up with ideas. And it's very much as many as possible, and then refining them after. Once we've got the ideas and we've decided which ones we think we want to kind of go with, it's the next step, which is kind of prototyping. Very common kind of thing, but essentially turning those ideas into something that you can test with people. And then that final step of actually going out and testing it with people, seeing what they do with it, how they react to it, if it does actually have an impact, make things better for them, could make things worse in that situation. But it's all about, and the reason why we've kind of say it's an iterative and kind of cyclical approach is every time you test something, you learn more from that testing. So all the feedback, the things you observe, the kind of data you get back, the feedback you get is all going back into that kind of first step of understanding. So it might be that you do this quite rapidly. You think of you find you've got a problem in front of you, you talk to a few people about it, you see where those kind of where you could have an impact, you prioritize them, you come up with an idea, you prototype it really quickly. And a prototype can be you write the idea down on a piece of paper, or you stand up in front of a few people and explain the idea. You put a video together, a presentation, something really quick. And the testing is you showing it to them and getting feedback from them. So like I say, this can be something that can be really quick and really cyclical over a number of kind of early phases of projects and kind of idea generation. So that's kind of our approach that we take. But the other thing that I think is really important for us is that we don't see this as kind of a really rigid process that we have to go through in a certain way. We kind of treat it more as a kind of framework to guide us. And why I say that is because we genuinely believe that you can start at any one of these points around this circle. So you don't have to always be starting from scratch. You don't have to always be thinking, okay, we need to kind of scrap everything that we've already got or we already think we know and starting from the beginning and going out and understanding again. But using this as a framework, we kind of almost like prompt it. So with some questions. So if you don't know what the problem is, you can kind of, it's usually there's a problem, but you don't know why it's happening. That's what we mean by you don't know what the kind of root cause of that or what's kind of contributing to that kind of problem showing itself or the symptoms being seen and felt by people. Then definitely go and start to understand, go and talk to people, go and understand and find out what's really going on for people. Go and watch what's happening, go and spend some time in the area that is happening, look at the data around things. There's loads of different ways that you can understand what's going on to really see what the problem actually is. If you know what the problem is, but you're not, or you've kind of done that bit of work, or you think there's loads of different things that are wrong with this, whether it be a system, a product, an idea, a kind of environment, but you're not sure which one to start with, then that's where you need to start prioritizing. So doing some activities around understanding the kind of value and impact of tackling different things first versus the things that can kind of come later. So you're able to kind of prioritize those. If you've done that, but you're not sure how to solve it, then that's where you start getting the ideas. So you've understood what the problem is, you've kind of picked the area and the place where you need to start, but you're not sure how to solve it. That's where you really get into that kind of creative space of really co-designing, understanding, and developing ideas. As many, and like I say before, as many as possible. If you don't know how to share that idea, so you've got your idea or a number of ideas, but you're like, okay, so we've all agreed that these are good ideas. How do we know what we're going to do? How do we share it? That's when you get into prototyping. So what can you do to bring your idea to life? And like I said before, it could be write it down on a piece of paper and pass it to someone to see their reaction, or it could be develop a really quick, basic website and show it to people, or draw a diagram or film a video or take some pictures. It could be anything that actually just brings your idea to life and helps communicate that idea to someone. That is essentially a prototype that you can then test. And you might be actually at the point where you've done all of that, but you just don't know if it'll work. So you think you've got a really good idea that you've kind of put together, or you've developed something. It could be a website, an app, it could be something, it could be a resource, a tool that you've kind of developed, but you're not sure whether it'll actually work or not. Then start to test it. Don't kind of feel that you've kind of solved the whole problem already and you've got to go with it no matter what. Think of it and shift your mindset into going, right, I'm going to test this now and get more feedback. And that's where you get back to more understanding. And you might need to go around that cycle again, because by testing something that you think's great and getting that feedback, you might realize that, oh, we've missed something here, or there's some context that we've not kind of understood that kind of changes our perspective and can easily change the idea. So you can go around that cycle again. So that's the framework. Like I say, that's how we use design thinking to kind of give us that framework so that we can work with people who are trying to solve problems, trying to make things better for people, where we understand, okay, where are we at this point? And what I'm going to give next is a couple of examples of how we apply it. And I think the first example shows a good way of seeing that you don't have to start at the beginning. You don't have to start with that understand kind of phase. And this is a digital product design kind of problem that we were working on. So this is through some research, a research funding pot through the, it was the I4I with NIHR funding. And this is a project that we worked on over the last 12 months. So there's a team that have developed a web app called DigiViz, and it helps and enables people to self-test their vision. And the problem that we're trying to solve is that there are loads of people on waiting lists to have kind of vision testing. And they've had examples where people have their condition has deteriorated quite rapidly, and we've had people losing their sight while they're waiting for one of those kind of initial appointments to triage to understand whether they need some further treatment or anything else that they might need. So they've they've kind of understood a problem. They've prioritized that actually there's a waiting list problem here. What can we do to solve that? They've identified that it's not, we can't throw more people at the problem. It's actually what can we do within that period while people are waiting to try and alleviate some of those issues around people losing their sight or kind of deteriorating quite quickly. Some way of prioritizing that waiting list and making sure those that need it more are able to be seen quicker. They developed some ideas around an app, and they've created this app. So what we've actually got for them is they are at this point now. So what we talked to them was is going, actually, don't think of this as your final solution. Think of it as you've developed a really good prototype. So this is where you need to be starting. So the questions that they'd kind of briefed us on was to really understand like what's going to influence how they access that technology and kind of interact with it. So really the practical implementation of this technology for people. And what other considerations need to be designed into that implementation to make sure people have equitable access to this. So it's not just something that if you, because it's a digital solution, we're very aware that people that have got that experience health inequalities are also very likely to experience digital exclusion. So that might be for a number of different reasons that they can't access the technology or don't have the connection or the skills or the confidence to use that technology to take advantage of opportunities and apps like this. So that's where we wanted to start. So we said, actually, what you need to do then is instead of trying to go and do a load of research without the context of the app, actually go and do that understanding by testing the app with people within environments that would make sense to and how you're expecting people to use it. So we took that app for them and we went and did some testing. So one of the things we did was they were doing the study around Cambridgeshire and Great Manchester. We identified communities using some data where digital exclusion, people are at high risk of being digitally excluded for a number of different reasons, and talked to some community organisations within those localities who were already supporting people with health and digital inclusion. It was almost like the perfect kind of place to go and test. So there was an amazing community organisation down in Cambridgeshire that we went and visited. We arranged a day where people were coming in and actually using the app, the DigiViz app, to like in a real situation where we were observing. So we gave them the guidance that comes with the app, gave them the devices they would need. So we overcome the practical kind of barriers that people may face. And we kind of let them at it and observed and then had some good conversations with them to understand some of the challenges that they either were facing or they might face if they were doing this without us in the room or without the support of the organisation we were with. So what we learned from doing that, so going and taking that thing out and testing it within the environment that people are expected to be using it in, was a number of things. So the app itself wasn't particularly easy to use if you had sight issues. So there's accessibility issues there, which wasn't a consideration during the design phase. Again, something that easily overlooked, but when you see it and see people using it, you think, oh God, yeah, of course, this is going to be an issue. We're asking people that might have sight issues to use something that's not easily seen on a screen. The instructions themselves weren't particularly great, weren't that easy to follow. A lot of language in there that people weren't quite sure of, and a bit of ambiguity in there. People definitely needed that support to complete the test first time. They said a lot of the feedback was, if I had to do it again, I'd be fine. But this first time, I definitely needed someone with me. And then the two others, which were really interesting, is that and the reason why this is because during the test, you have two devices and they need to be 2 meters apart. And then you need to cover one of your eyes while you're doing the test. A bit like when you're at an optician and they put the kind of blanked out lens in. people's ability to measure 2 meters is very varied. Like some people were putting it about 2 feet in front of them, others were putting it about 5 meters away the other side of the room. So that was a bit of an issue. And because they were using a handheld device, they were constantly forgetting to cover their eye as they were doing it because they were needing two hands to use the digital device. So our recommendations off the back of that for that next iteration for them to go in there is they should definitely do an accessibility review of the app. There's standards that they can do that, the kind of WCAG standards that they should be adhering to. So there's some practical ways in which they can improve that. There's the accessible information standard as well that can give good guidance to improving the way that they kind of put that information in the instructions together. They should definitely look at co-designing community support models. So rather than just putting this into people's hands in their home and expecting them to use it there, are there places within their local communities that they could go to, such as a library or a community centre like the one we visited, and kind of almost build a service and a model around that. And then the other two things that they're putting in there is a paper tape measure, a bit like the ones you get at IKEA, so people can easily measure out the 2 meter and be consistent with that. And they have temporary eye patches that they can include in the kit as well. So really practical things that they wouldn't have seen if they hadn't gone out and kind of taken that design, that user-centered design approach of putting it in people's hands, letting them use it, observing and really kind of understanding what the practical implications are of doing that. So a really kind of good example of where we took something out in there. And then the second example is just, I'm not sure where people are at with their work and where their projects are or things like that. But another way that we've applied this over the last 12 months is actually at a strategic level. So North East and North Cumbria Integrated Care Board needed to develop a digital inclusion strategy. It was part of the guidance that came out a few years ago that all ICSs should have one in place. And they'd created one and they'd gone out and they'd kind of got feedback on it. And the feedback was very much that it said the right things in terms of it had the right stats. It was kind of talking about people's ability to get access to a device and a connection and digital skills, but it didn't really feel like it represented the true challenges that people were facing when trying to access health and care services. So our brief was to go and find out what really matters to people and what they're experiencing when they're trying to access health and care, especially where digital is playing a role in that, whether that be through an app like the NHS app, or whether it be just the fact that there's a digital system that they have to interact with when booking an appointment at their GP, or they're receiving information from clinics about ongoing kind of, it might be a physio exercise that they're supposed to do, things like that. There's a lot of digital involved across the board. So what are their experiences and what are the real needs that they have to overcome some of the challenges? And also really thinking about how can we design a strategy that meets those needs? So kind of turning that lived experience that people are into what can we actually do about it practically as a system, as an organization. So like I say, this is a much more less kind of individual product transactional thing that we're trying to design for, much more strategic kind of overall system thinking part. So again, looking at where we wanted to start, they'd already kind of been around this cycle. And that's what we were talking to them about, because what they'd done is they created their first draft was essentially their prototype, and they'd already tested it by sending it to a number of people and getting feedback on. So they'd already started to kind of understand more, but they really didn't understand what was really going on for people out in communities because they'd not done that work. So again, our first port of call in that situation is to go and spend some time with people where they are. So we went and spent a few days up in Newcastle. Found some amazing organisations across the city and across the region who are doing a lot of work already to support people in their communities who are facing digital exclusion and other forms of kind of exclusion, especially when related to their health and care. We had a lot of conversations, a lot of phone calls, a lot of face-to-face meetings. We did a few workshops with a lot of stakeholders over there just to really understand that and kind of go through that cycle. And we also did, and this is what I was alluding to a little bit earlier, within that understanding phase, we went and did and found what data do we have that is available to understand the state of digital exclusion across the region that we were working in. So we took data from publicly available data sources, so your ONS and places like that, to look at risk of people being digitally excluded. So a lot of the factors include things around like multiple deprivation, barriers to housing, rurality of the kind of area, age of the population within that area, and pulling all that and layering all that data together give us a bit of a risk score, so we can identify within these areas where are people at greatest risk of being digitally excluded and what is going on within those areas to support people. So that's the kind of capacity side of it. So are there existing community services? Where are the health places within those localities as well? So it's actually one of the contributing factors, the fact that there isn't a GP within that local area. It's in the next ward or round the corner, but it's kind of classed a different place, or there's no real great transport links to it. So there's all these different things that we can identify through data that helps us go, this is where we should start. We should really look at these areas where the risk is really great and there's not much support going on at the moment. So how can we actually overcome the challenges for them? So again, just using a bit of data there to help with that understanding phase. And we went through that cycle. So once we kind of went through that understanding phase, we'd learn a lot about these kind of things. So one of them was that digital inclusion can't be done in isolation of other inclusion work. So a lot of challenges people were facing were things like language barrier. So even though there was support to help people use the NHS app, for example, within their communities, there wasn't provision and support to do that with translation to enable people where English isn't their first language to do that. So we had organisations in the community that had waiting lists of like 200-300 people, but they just weren't able to support them because they didn't have the support and the funding to do the translation work and the interpretation work there. So some real challenges. There's a real focus on fixing people. So it's almost like the digital thing's the right thing, but some people can't use it. So what are they going to do to get themselves up to our standard? Whereas we're trying to flip this on its head and say, actually, you need to focus on fixing the system, do the work that needs to kind of bring and make our services more accessible to people. And definitely the idea that you need to do that within services themselves. So where people meet the NHS, that's where you're able to do the work to overcome that, because there's so much digital inclusion. I'll just kind of mention this. Digital inclusion is really well known at a kind of strategic level because it's in policies and things like that. And it's really well known on the front line because people see it and experience it. But there's so many other layers in between where it's really not really known, or the impact of it is known. So we had to do quite a bit of work to try and help them understand what they can do within there. So our recommendation off the back of going through that kind of design cycle, going into kind of understanding it, was to help them create a kind of an adaptive system of kind of learning or measuring learning and adapting around a number of different areas. I'm not expecting you to read that, and I'll not go into too much detail, but just an example of how that design thinking approach that we took was able to kind of come out with a way of solving or breaking down a big strategic problem, as well as that example that I gave before of a real practical, tangible kind of transactional app problem as well. Okay, so I'm just going to finish with a few design principles, if that's all right. And if any of these look familiar, it's because we developed these, or me and a couple of colleagues, when I was at Good Things Foundation, and they were adopted by NHS themselves. So there's some through the NHS service manual that are in there as well. And we've kind of, Thrive by Design, have kind of adopted them as well and kind of evolved them as we go. But and some of them might just seem really simple, so please don't worry. They're there for a reminder as much as anything, and keep us back at that core of going, what can we do that really will ensure that we're putting people first, users at the center of our work with our user-centered design work. So first one, design with people, not for them. So obviously it's something I'm sure most people are kind of aware of, but they are the experts in their lives. They know their world. They know what matters better to them. They know their experience better than we can kind of assume or guess. So make sure we're bringing people within that process. Going to where people are is really important. So early on in my career doing user-centered design, most of my work was bringing people into offices and doing workshops, post-it notes all over the wall, kind of expecting them to come to us. But we found like actually you're kind of creating a false environment. So you're bringing people into your world and you almost feel like they'll tell you what they expect you want to hear rather than actually us going out and really understanding what's going on for them. So wherever possible, if you're trying to solve a problem, go and spend some time where that problem exists in those communities, and community centres and community organisations that are doing amazing work are really great places to kind of start. And there's the Good Things Foundation, they've got a network of thousands across the country. So if you're looking on their website, you'll be able to find one within a stone's throw of where you are, especially across Greater Manchester. There's loads. So they're great organisations to start with if you're really trying to understand what's going on for people out there. Another principle of ours is to kind of start conversations rather than surveys. So we found the value of a conversation is much greater than that of just the answers that we're kind of asking the kind of preset questions to in a questionnaire or a survey. So surveys are great. You can get kind of volumes of data and spot trends and patterns through that. But where the real rich stuff comes is just those conversations, just starting a conversation with someone within their environment and understanding what really matters to them. We did that when we were working on a project with a homeless community in Hastings. We went down, spent 2 days there with nothing other than ourselves and just spent some time in the centre, sat down, had a meal. They were doing a kind of hot meal every day, sat down next to a few people and just started a conversation, played a game of Scrabble, played a game of pool, kind of just involved ourselves within that community and started conversation. And we learned so much from that. And also, I think if we'd have gone down there with a preset kind of questionnaire and started to kind of interview people, I don't think many people would have bothered. I think they'd have kind of looked at us, seen us as some sort of official kind of person or organization and kind of stayed away from it. So it's really helped us that. Another thing we always look for is trying to understand what the relationships are within a kind of situation, especially around health, because people have existing relationships and trusted relationships with not only people but organizations, with peers, with digital tools that they'll use, and they'll trust certain things but not others. So pretty sure we all know that people will trust Google to give them a really good cancer diagnosis rather than the actual professionals. So yeah, things like that you just can kind of pick up on rather than just focusing on we're trying to get you to move from this point in your journey to this point and really focusing just on that transaction. Understand what's really going on around that for people can be really helpful and spot really interesting ways in which you can solve problems. And then the last four related to that, so really understanding underlying behaviour. So just be conscious of your bias and your assumptions that you'll make. Keep questioning, keep kind of observing, keep looking back over the insights that you're getting, the trends that you're kind of spotting within that, and really kind of questioning whether you're making too many assumptions within that, because people's behavior is really influenced by a lot of other factors around them. We always talk about design services enabled by digital rather than just the digital thing. So start by understanding what are you actually trying to help people do, what are you enabling them to do, and then think about where digital kind of can play a role in that. Because we often see people, a lot of our projects are, we need you to come and solve this problem. And it's this digital thing within this service. And we go, okay, so what is your service actually trying to do? Because there's often opportunities earlier on in people's journeys there where you can make improvements that mean when they get to what might be a bit of a bottleneck at the moment, that can kind of be overcome or eased a lot earlier in the process. And then the last two are just about the way we work. So where possible, we share our learning. We do things like this. We publish things on our website. We try talking quite openly about what we're doing and being really transparent about how we're working. We do that within projects as well. So loads of show and tells and demos of where we're at and what we've heard, and do shared kind of sense making sessions with the people that we're working with so that they can really understand what we're hearing and why we're making decisions in the work that we're doing. And the last one is kind of do it now. And I say that just because, as I mentioned earlier with design, I genuinely believe you can go through a design cycle in like 5 minutes. So if you've got a bit of a problem or you're not sure, you're a bit stuck, having that framework to look at and go, where am I within that? Okay, I'm here. then I need to do the next bit. Great. So you can kind of do it. And so having that allows you to kind of, rather than sit there thinking, oh, I'm going to have to get a team together, or I'm going to have to wait for the next meeting or bring a workshop together or something like that. Actually, what can you do right now in front of you to kind of try and unblock yourself a little bit and kind of move forward and see what the next step is on that journey. And then there's just some useful resources, and I can share these slides definitely. But our website, like I say, we try and share our learning on there about our different projects, and there's blogs and resources on there as well. We've got a future NHS workspace that you can kind of sign up to, and I think there's might even be 800 plus people now within the inclusive digital transformation workspace that we manage. And then the Digital Health Lab website is from the work I mentioned when I was at Good Things Foundation, and there's loads of stuff on there because we almost like live documented that whole project. And there's lots of evaluation. There's things in there around return of investment in terms of designing inclusively with people. There's the principles I've talked about, all that sort of stuff on there as well, which is a great resource. Okay, I'm going to stop talking.